Sir, we can start now. Huh?
Yes, yes, we can.
Okay. Hi, good afternoon, all. Today we are gathering here in this platform of IFPH. IFPH is the International Forum for Promoting Homeopathy, which only concentrate on the field of homeopathy and to promoting homeopathy all over the world. It's made last year, which only let know to the society how can defeat the current situation of COVID pandemic. Now it has been expanding more than 100 countries in the world. Most of the delegates are coming here and take sessions each and every days. And homeopathic lovers also coming here from all over the world. Last week, we celebrated our 300th day. IFPH humbly says that the simple, popular, and less expensive homeopathic medicine can save today's world, and it is very helpful in defeating the pandemic. During this time, we created one student group also, which is formed internationally. We are conducting various webinars for students in the name of Conceptual Truthing Edge 2.0 every Sundays. Today, our 28th session is starting here. Our chief guest, Dr. Dhanesh Jayasimhan, joined with us. Now I pass the mic to our respectable moderator, Mr. Roy Thomas.
Good
Roy?
afternoon. So today you are here to talk about COVID management with homeopathy. Am I audible?
Yes, yes.
Yes, you are audible.
So, and so what do you what do you think about the present condition of COVID management, and can we deal with homeopathy? Is there any other medicine than ARSA that are more effective?
Yes.
Roy, please invite Basavaraj for welcome speech, and after that we can talk.
Okay, here I invite Basavaraj for the welcome speech. Basa, okay, can unmute.
Can you hear me?
Yes,
Hello?
yes, we can.
Good afternoon, all. Good afternoon, all. Today we have our resource person, Dr. Dhanesh sir. We know in our IFPS meeting every day he will be there and he will be asking some questions and he will be giving some suggestions about current scenario. And today we are he is going to explain about homeopathic treatment in COVID cases. And when I'm explaining about him, he took his graduation on 1983 from Adhura Ashramam Homeopathic Medical College, and he was a former district president ISK Alapura and former secretary ISK Chertala and general convener Hanimanian Study Circle Chertala, and now currently he is member of ISK's faculty cell, and took more than 100 classes for doctors, took more than so many classes, awareness classes also. And he is also a writer at I Love Homeopathy, published more than 30 articles in magazines and newspapers, and attended so many radio programs and live programs at various channels. And I invite Mr. Dr. Dhanesh sir to this platform. And sir, please.
Okay. Good afternoon, everybody. I'm very happy to be back with these students platform for the second time in this session. I think this is the second time I am joining with you to share my experiences. And the first time I took a webinar on my experiences, how I become a doctor, how I become a good physician. That whole thing were discussed in the early part of the first session. But today I'm here as a stopgap arrangement because somebody was some other doctor was here to be at the faculty, but unfortunately he was not available on this day. So I was asked to do webinar for students. Willingly, I was able to come here and share some of my cases. So I shall give my experiences so that your confidence, this is nothing but to boost your confidence rather than my presentation is for no other purpose of this presentation. So this presentation is particularly for students only. So those who are interested can ask question in the last part of the session. So shall I share my screen now? Share it. Can you share? Can you see the sharing?
Yes, sir.
Ah,
Yeah,
yes,
sir.
Doctor.
Eh?
Yes, Doctor.
Yes. Okay.
Uh,
Okay. There was some technical problem. That's why I have to stop in the midway. So anyway, we are back with this COVID-19 and its homeopathic management. What I usually do is I used to take the videos or audios or sometimes photos of the patients when they visit me. I'm quite confident that we will be able to cure the patient. So we need evidence so that then only we can show the world that we are doing homeopathy, this sort of cases to cure with these patients with homeopathy. As you know, COVID scenario was different, and everybody, even homeopathic doctors, were not allowed to practice the COVID cases from the very beginning. But whenever patients come to our clinic, we need to address to them, and we need to take the case and find out whether it be a case of COVID or not. It does not mean that we can't treat, because we treat the patient and not the disease. So whatever be the case, that is the basic difference. I have to tell you that this whether when a patient comes to you, then sometimes you may ask what is the basic difference between the patient and the disease. As you know, everyone, whenever you get a disease, you may be a different person. So, no, all patients in a same disease react to each situation in the same way. Both everybody have their own differences. So their own individual reflection, their own individual variations also. So this is the reason why we say that we can treat COVID without much problem and without much this. Why we say that homeopathy has treatment for COVID? Because we treat the patient. Then who is the patient? A patient who suffers from some problem. Whenever a person has an altered state of mind or his body, he may be called as a diseased person. Or sometimes he may have problems in the mind as well as the body. So that also is another case of deviation from normal well-being. So these are the circumstances we need to treat the patient. So, for example, when a fever case comes to your clinic, you have to find out what are the reason for. First, you have to ask the question, what happened to you? That question itself is, doctor, I was exposed to rain yesterday, and that's the reason I got some fever. Then you have to question whether you get the fever as every time when you get fever, rain, exposed to rain. Yes, doctor, I get fever every time. So in those cases, you can think of remedies like Rustox. Then for this is that patient required maybe Rustox. In another case, a patient comes and tell you that, doctor, I am suffering from fever because I was exposed to sun for a long time yesterday because I have to play cricket yesterday, and I was exposed to this sunlight. And whenever I get so much exposure to sunlight, even if I was simply waiting or standing in sunlight for more than 1 or 2 hours, I may get fever. So the cause here is exposure to sunlight. So in those cases, you can think of hot remedies like pulsatilla, netramur, netranka, like that. So in another patient comes to you and say tell to you he may say that, doctor, I was having examination yesterday and I was so much frightened about that, and so I was having a little bit of fever just before examination and still it is continuing. So you can think of another remedy here, that fear ailments from fear of examination, a fear of something to do, so anticipatory. So then you can think of Naxomic, Gelsemium, all those remedies. This is how to differentiate patients from one patient from another patient. So this is what is the purpose of explaining. So it doesn't matter whether it is a case of COVID or measles or chickenpox or even dengue fever. There is no much to change. Whether you can treat all these cases with the same medicine and not like the other one what we say in this case. So let us go back to our main subject. Before beginning to the subject, I would like to say homage to our doctors who lost their life due to COVID. One among them is Dr. Prabhu Jekar, who was the founder of British Homeopathy, and he's one of the legend homeopath who was here in India. And so let us pray for him for a silent prayer for 1 minute. Okay. This is an article written by me about COVID treatment, about COVID in and Malayalam Daily Kerala. As you know, most of the papers in most of the media were not reporting about homeopathic treatment for COVID, but I was able to write an article in Malayalam in Kerala Kaumudi, and I have given videos to them to make sure that they will publish the same, because once they go through the video, they found that whatever I am stating in the whatever I am stating stated in these article was 100% correct, and because of that they published. This was the first article published by any of these daily about cold treatment in Malayalam. So this is the first article, because whenever we give evidences, then only they will come to present the news, because they were forbidden from doing the same by the other people who are not interested in the development of homeopathy, because homeopathy is a fast developing system which is growing day by day, and we are the second largest system among the medical system, whole medical system. So this was published, and I got a very good response from different part of the in Kerala. People from different part called me and inquired about the homeopathic treatment. So I was able to direct them to different doctors at different cities. So these are the things you as children, as students, you have to do. Whenever you get a case, you try to collect evidences and keep with it, and then definitely today or tomorrow you will be able to publish such articles with with this evidence, and then only they will publish. So this shows the importance of keeping evidences. So then, as you know, arsenic album, the most talked medicine as far as the second after COVID, because arsenic amalgam 30 is being used as the preventive for COVID, and it was one of the biggest success we got through with the arsenic album. because the person named Faisal from Malady from Dubai made an audio, and that clicked all over the world, and that really makes the difference. Once this audio came out, people from all part of the world are searching for arsenic amalgam, and most of the people are taking arsenic amalgam regularly, and they were able to protect from the disease. Even their arsenic amalgam shows better result than even the vaccination. I will come about that later. Then, as you know, the science of homeopathy. What is science? This is one of the things that we may have to know. Homeopathic science means it is just like a table having four legs. The first leg is knowledge of health, that is the order. Then the second leg is knowledge of disease, that is disorder. Then the third leg is knowledge of laws of homeopathy, which completes all of the things that is written in organon. Then the knowledge of cure. As you know, these are the things that you have to know. When the science of, so these are the four things that together forms the science of homeopathy. Entirely not the protocol of science by the allopathic world, but we have our own definition of the science of homeopathy, and this is what the science. Then we used to say that we have another part called art of homeopathy. Then what is the art of homeopathy? That is, the application of this knowledge for the purpose of cure can be called as the art of homeopathy. This is the base. That's why we say that homeopathy has as a science in it, and the other side we have the art in it. Those doctors who are best in application of this science for the purpose of cure are getting more and more patients day by day, because if not all artists get good patients, good appreciation from all over the world, but those artists who are having a special love for the same get more and more appreciation. This is what, first of all, those who in Kent it is written that the person who loves homeopathy for the love of homeopathy is the better practitioner than anyone else. So whenever you do practice, you just love it. Whether you do whatever thing you do, you start enjoying. When you start enjoying yourself, definitely you will be able to win the heart of the people, and you will be able to win the race also. So what are the thing important for being a good practitioner? The most important thing is case taking. The second one is analysis. When you take a case, then you just analyze it in the correct way. Then the next step is selection of simulum. After analyzing the case, then you have to select a simulum. There are different ways of one. You may call it as classical prescription by repertorization, then artistic prescription by your experience, and pathological prescription by means of prescribing a remedy according to the pathology. For example, for jaundice, it is the pathology here is something that happens in the liver. So you have to choose a remedy from the liver, from the list of medicine that is having more action on liver. So that's, for example, that's how we say that. Then after casing, what are the things required? As you know, the first thing required is observation, and the second thing is just listen what the patient is telling to you. Then you need to touch the patient to find out whether what kind of the touch means. For example, if a person comes with fever, you just touch your head with your hand. You can see the head may be very hot. Then you touch on the legs, you may find that the leg is very cold. In some other patient, you may touch the head and feet together, both are hot. In some other cases, it may be icy cold, but even the temperature may be 103 or 104. So you have to differentiate these things so that you can select different remedies in these situations. Then You may get smell. You may have to think when a patient enters. If, for example, a person having very having a caries of teeth may open his mouth, and there may be offensive odor coming out from his mouth, so that you can prescribe on that way. Sometimes a lady comes to your clinic and sitting in front, you can see some offensiveness coming. And when you ask about the leukorrhea, she may say, that, doctor, I cannot see enter into a part because I have a profuse, I have a foul odor coming from my leukorrhea, like that. Or sometimes there may be patients who are telling that, doctor, I have a profuse sweat and it is miserably very offensive. I cannot even sit in among with others. So these are the things that you have to looks into before taking a case. Then how will you the second thing is to interpretation. And then, for example, a patient comes to you and describes that, doctor, I have this problem, and that then the bystander may say that, doctor, he's telling die, he's having no problem, like that. Because sometimes most of the bystanders does not want to explain about all these things, all about their private matters. So they may be telling lies, but the patient may be telling right, or vice versa too. So in those cases, as an intelligent doctor, you have to find out what is true, what is the truth behind this, and then only you will be able to interpret whether the case is whether the patient is telling right or the bystander is telling right. So these are the things that you have your intelligence need to be done. Then how will you select a remedy? Then also you can think the cause. The cause is primary cause is the most important thing. There is a cause behind everything. So whenever actually the patient coming with the effects, so you have to find out the cause. Sometimes, for example, a child is coming up to your clinic with a fever, and then he says that. Then you are asked, what happened to you? What is the reason behind it, like that? When you question like this, sometimes the mother may say, doctor, she used to get first rank in every time, every examination, but this time she got only second rank. So after hearing that, she was shocked, and then after that she developed this fever. So that is more important than the fever, whether it be 104 or 103, it doesn't matter much. But if you know the cause, then you can definitely choose the remedy in the shortest possible time. So this is what I want to say about the case taking. Also, this is one of the important factors. Then management of acute disease, as you know, it is the management of acute disease, as you know, certain origin is short span. Just like we say, just like a storm, it comes and goes, like whether you win the race or not, sometimes you may lose on the way. Just like you may be saved, or either the patient may recover, or sometimes he may go for the other side of life, that is death. So you have to find out the different reasons when different things when a patient comes, the activity, whether the patient is active, whether the patient is having a hot or cold feeling, whether the patient has test or not, then temperament, whether the patient is sanguine or cold, like that. These are the things also will give you to select a remedy in a very short span. For example, I will show you some of the cases. I don't want to explain all this. If you look at the patient, you see this patient is having hydrocele, and look at the appearance of this patient. He is coming to my clinic, and this is the typical example of, as everyone all of you know, that this is the classical picture of sulfur. This patient is having very offensive smell coming out from his private part, because his hydrocele is so large, was so large, and he was having a very good recovery after sulfur syrup 3 was given. He was having very good relief, but still he is not a regular patient. Whenever he is having problem, he used to visit me. I give him a free treatment because he is a very, very poor man. Then let us see, say something about the trials. As you know, arsenic amalgam, phosphorus, lead-200, tuberculin. This is a trials developed by Dr. Revisar and his team. And this also works as a very good preventive. And if somebody want to know about all this thing, I will come up later. We fought in the case, and we won the case at Supreme Court, which allowed us to practice homeopathy. And these are the things that I would like to. Then, as you all know very well, the common symptoms of this, right? The most common symptoms, as you know, fever, dry cough, tiredness. These are the symptoms in the very first thing. But now the second wave, it is entirely different. As you know, patients comes with directly coming with a very severe cough and very severe cough, and just like pneumonia, people starting with pneumonia, and some of the patients comes like just like the vomiting and diarrhea and very profuse diarrhea. Sometimes you may be mistaken that it's a case of cholera or dysentery or something like that, but actually it may be a case of COVID. Whatever be the symptom, for example, there are patients who are coming with severe pain in the ear, and if you look at the test for COVID, the COVID test may be positive. Sometimes there may be severe pain in the chin and severe pain in toothache also. If you test for the patient, then you may get a COVID positive. So, what any symptom, any problem can be a case of COVID. This is my advice to all of you. Don't consider that these are the typical fever, dry cough, all these things. But it does not mean that you require all these things for the COVID case. Whether it does not mean, even if a headache that may last for 2 to 3 days, even without temperature, may be a case of COVID. So this is something different that you have to study. This is the second wave. This is the difference between first wave and second wave. And as you know, these are some of the remedies that we used to practice with the COVID. So let me come directly with some of my cases. So this this person is having let me come up. This person is the husband of my patient. She was having polycystic kidney. As you know, both kidneys of his wife damaged and full of cysts, and the creatinine level was 10.5. As you know, no, please note 10.5, which is very high as far as the other side is concerned. Actually, one need to control the creatinine level below 1.5 or 1.4, but here it is 10.5. But now let us hear what he is about to tell. Now I shall explain what he was telling. What he was telling, actually, his wife was having severe fever and cough at when they were staying at Bangalore, and she was under my treatment for polycystic kidney for the last 3 to 4 years. She was having no other problems, but even though there was high risk at that time, it was 7.5. Creatinine level was 7.5, but you can see in here, if you look at here, you can see the creatinine level is 10.20 here, 50, I think. This blood picture was taken after the recovery of COVID. Actually, when he was having this fever, when I told them that it is suspected to be a case of COVID, so what they did was they just went for an RT-PCR test at Bangalore, and they found it was negative. So they thought it is better to come back to home. So they came to our village. And after reaching with the village, they called me to and they informed that doctor, she had severe fever and cough, continuous cough in the morning. So they want to visit me. So then I advise, please, better not to come now. You may please go for one more test here. So they went for the hospital. They went to the nearby hospital and tested, and it found that the COVID test was positive. So actually, it was a case of COVID pneumonia from the very beginning, and she couldn't even talk. She couldn't even the cough was something like moving cough, very continuous cough with profuse cough, and then vomiting also. Everything. She was so tired, and that case was. Typical case of temperature was more than 103 to 104 like that, and pulse rate was so much rapid 120 like that, and everything was there. So I just advise them to sit in the home and just wait in the home and say please send someone else, and I just give medicines for that for her as well as the bystanders there, and everybody took the medicine and as you know, the medicine given was at the time was Drosera and Mephaitis. These were the two remedies because both are having these symptoms, continuous paroxysmal cough coming out. I have to give, and pyrogen also was given, and later I have to give some other medicines also. So as you know, the COVID, we never stick on to single remedy, as because this is an acute illness. It can be person at any time, and even they were given aspartame tincture for even if a condition which in which the oxygen level may fell down, but frankly, it only once the oxygen level came down, but it doesn't make any difference here. They didn't took aspartame tincture, though they were having. I was given them to keep it with them, but I was able to cure in those cases with these medicines, and then followed by in the later part I have to give anti-ARS also. Then Lacus is also given, and because as there was a reduction of this oxygen level, and frankly, no other medicine were required in those cases, but she was given biochemic remedies, Paramphosphate with Calimore in the beginning to end, and that really works for her. And in between, I give Calcarea self sixes also. So in acute disease, you may have to change medicines frequently, so that that may benefit the patient, because you need to prescribe uh, uh, to the present rather than to the future or to the past. So these are the things that you have to keep in mind. And what I am my present purpose of presenting this case is to show you that we can treat patients with comorbidity in this COVID situation without failure. This even do you, all of you know that if the patient is sent to some other medical college or somewhere else, she may be no more here, because only 15% of her kidney is working, and she cannot tolerate this steroid or and anything. Even antibiotic may do much harm to her, and she may not be able to survive this COVID. And that is the reason why most of the death happens in nowadays, because of the wrong treatment by allopathic doctors. Not because of the COVID they are dying, but it is because of the wrong treatment they are dying. This is one of the reasons we need to think, because in current situation, better not to be and allow patients to take paracetamol. Paracetamol definitely reduces the temperature. Once the paracetamol temperature comes down, the intensity of infection will be so high, and the patient may develop much internal problems more and more. That's why symptoms like cough and pneumonia, all these are happening. And I will show some other cases also, so that you can understand how these medicine, allopathic medicine work for them. Definitely, better not to suppress the temperature. You just allow the patient to continue with the temperature. Nothing will happen. No, I don't think that in all these cases we need not to go with the arsenic and alone. We need to give different remedies in different situation, and that is the beauty of homeopathy. It does not mean that arsenic album is not at all a remedy for COVID, but it is not so. Arsenic album can, in some cases, arsenic album alone can cure the patient. So this is what I have to say about this patient. She was survived. She was able to she was able to run her clinic, run her day-to-day life. She's working as a teacher. Now she is sitting and day-to-day for teaching her school at Bangalore. Now she is in our village, and she has to sit nearly 10 hours in front of computer to teach the students. So there is no other problem with her, no edema, nothing like that. Even if we send to the patient for some allopathic nephrologist, definitely they will advise for this dialysis for a patient who is having 10.5 creatinine level. So these kind of patients are also there with us with the homeopathic doctors, and we homeopathic doctors can manage this without much fail. And this is what the purpose of showing this case here. Okay. Uh, this is another case. This is not a total COVID case at all. I just want to show you the beauty of homeopathy in observation. You see, this patient was about to die like that. A situation one fine morning, his this lady called me and, doctor, please come to our clinic. Yeah, but it was about some 6 a.m. in the morning, and I just went visited there, and everybody wanted to know whether this person was was undergone death or not. But frankly, when I found that the only way he was in collapse condition, icy cold body, and the fan is working there, AC is working there, everything was working, and no pulse, no nothing like that. But when I pressed on his collar, I found that there is a carotid pulsation, a slight bit of carotid pulsation. So I was having a Karvovich with me, and I just gave her Karvovich immediately. And but I cannot apply it in the mouth because our mouth was closed completely. I just diluted it in and then applied on the lips a little bit and asked others to massage the body. And this is what then I was able to give some CPR, and that also I was given. That was given anyway. He was able to survive after some 30 minutes, and later it took 1 hour for me to leave from there. And by the time his BP was 50 by 30. So in the evening also I just visited, and after some 3 days everything was fine. And so I just saw you fifth day. This was the condition of the patient on the fifth day, and the seventh day this is he is sitting, and everything was okay. So what I want to say is that even in these conditions, this may be a typical condition you may get in COVID also. So in those cases, carbamide or lacasis, which is the medicine that may works wonderfully for the patient. And here, carbamide alone saved the patient. This is another video of COVID. But can you hear here?
No, sir, we can hear.
Can you hear?
No, sir, not audible, sir.
Not able to hear. I shall explain.
Okay, sir.
Uh, actually, this man was tested positive COVID, and by the time they were allowed to sit in the home and take their own medicine. So this woman was taking, was my patient for PCOD. So when he got this fever, he called me and they called me and asked about and informed me that we are tested. He was tested positive by COVID-19. So I was able to. I just asked them to come send someone to my clinic and given the homeopathic medicine. He was given Rustox because he was exposed to rain some 3 days back, and after taking this Rustox, he was getting very much improvement. And in the meantime, this his wife was there, and his child and his mother went to some other home in the nearby. But after reaching there, some 2 days later, she also, the mother and the child developed fever. Then they came back to their home also. They were also tested positive and they were given a medicine. This child was given Pulsatilla and his mother was given uh, Mercenicum album, because the purpose of showing this case also is that we need different remedies in different persons in a home, and don't think that all of the patients in the home require same remedy. It may not be right. There may be different remedies required. So in all these three cases, all these persons are able relieved from this COVID within 7 days. But unfortunately, in those days, test usually come does in the 10th day only. So they have to sit in the home for 10 some more days before testing. But nowadays things are changed a lot. Nobody is asked to test for negative test. Only confirmatory test is done, and no, thereafter there will be no more test at all. That is the purpose of showing the case. Even the child is also saved in a better way. I have one of the experience I would like to share to you is that I got a patient by about 75 days only, a child of 75 days, her mother, her grandmother. All these three persons got COVID-19 on the same day, tested positive because her uncle was having COVID just 1 week before, and after one week of his disease, they were all tested and tested positive, and they were also having symptoms of COVID also. This child, that child of 75 days having very high fever, but the temperature of the head was very, very high, very high. Please bear 1 minute. I shall.
Sir,
Hello.
yes, sir, audible. No, sir, no, sir.
No,
Sorry.
not audible, not audible.
ഹായ് ഞാനിവിടെ വന്നത് എൻ്റെ ഒരു എക്സ്പീരിയൻസ് ഹോമിയോപ്പതി ട്രീറ്റ്മെൻറ്റ്
Hello,
കോവിഡ്
ഇപ്പൊ
ടൈമിൽ
കേൾക്കാവോ?
അതിൻ്റെ ഒരു
Sir, sir,
എക്സ്പീരിയൻസ്
sir. Yes,
ചെയ്തിരുന്നു.
sir,
കേൾക്കാവോ?
audible.
Audible,
Can
audible,
you
audible.
hear?
കോവിഡ്
Audible.
വീഡിയോ വേണം അച്ഛൻ്റെ വീഡിയോ ഓണാക്കണം.
This was the child we were talking about. Now she's about 9 months old and she's playing very good. In the beginning, actually, this child was having a head on the temperature, very high temperature on the head, and her legs were so cold. So that is the indication for Beltrona. I just give Beltrona alone, and within Beltrona 1 was given. She was required within 2 days, and there was no more complaint. But on the fifth day, she was feeling drowsy, and there was some problem with So mother was so much afraid, and then they called me, and then immediately I gave them opium anum 1 dose, and thereafter within 1 hour she was able to play just like a normal child. So only that 2 remedies were required for this patient, and her mother required phosphorus, and phosphorus 30 was given, and later barium was also given as per the because she was much worried about this child, but she was anxious about this child, and as you know, in those situations, a child having 75 days of uh, life getting COVID is a very, very different one from the normal people, because everybody was worried about this child. But frankly, nothing happened. She was very active, very, very active. Now she is 9 months old. This picture is the latest picture taken by me. And their grandmother was given some other medicine, and I hope that she was given Rustox or something like that. I just forget about that. But because the purpose of sharing this case is that we can treat a patient from any age, whether a very small child or a very young person, a very old person also. I have treated a case of COVID from 85 years of old who is having a cardiac problem also, but still he was able to survive. And I was able to treat a patient who underwent cardiac surgery some 3 years back. For the person was the father of the women you have shown. I have shown in the other video just back, and he was also recovered within 7 days, 7 to 10 days, without any problem. So we can manage all kind of COVID. This is another example of treating children in COVID. You can see these 2 children were affected by COVID.
അത് കൂട്ടുകാരൊക്കെ ആയിട്ട് കളിച്ച് അല്ലേ?
This boy, this elder boy got COVID first time, and after some 2 to 3 days, the younger boy also.
ചൂട് ഛർദിലുമായിട്ടാണ് വന്നത്. ടെസ്റ്റ് ചെയ്തപ്പോൾ എല്ലാം രണ്ടുപേർക്കും പോസിറ്റീവ്.
That positive.
മോൻ പോസിറ്റീവ്, മോൻ്റെ ടെസ്റ്റ്. അന്ന് നിങ്ങൾ എല്ലാം നെഗറ്റീവായിരുന്നു. അത് കഴിഞ്ഞ് നമുക്കൊട്ട് വന്നുമില്ല അല്ലേ? നമുക്കാർക്കും വന്നില്ല. അന്ന് നമ്മൾ പ്രതിരോധ മരുന്ന് അന്നേരം നമുക്ക് തന്നായിരുന്നു അല്ലേ? വീട്ടിൽ അന്നേരം വേറെ ആരൊക്കെ ഉണ്ടായിരുന്നു? നിങ്ങൾ 4 പേരും മാത്രം. വൈഫിനും വന്നില്ല. ഇവർക്ക് വേണ്ട ഒരാഴ്ചക്ക് ശേഷമൊക്കെ തന്നെ മാറിയെന്ന് തോന്നുന്നു അല്ലേ? ടെസ്റ്റ് ചെയ്ത് 10ാമത്തെ ദിവസത്തിലേ ടെസ്റ്റ് ചെയ്യുള്ളൂ. മോനും അതുപോലെ തന്നെ 10ാമത്തെ ദിവസമാണ് ടെസ്റ്റ് നെഗറ്റീവായിരുന്നു. വേറെ പ്രശ്നങ്ങളൊന്നും ഇല്ലായിരുന്നു അല്ലേ? അന്ന് നമുക്കൊക്കെ പിള്ളേർക്ക് വന്നുകൊണ്ടൊരു പേടി ഉണ്ടായിരുന്നു ഇല്ലേ? എന്നിട്ട് നമുക്ക് വന്നില്ലല്ലോ. ശരിക്കും കോവിഡ് അത്രയേ ഉള്ളൂ. ഈ പറയുന്ന പോലെ പേടിക്കേണ്ട യാതൊരു കാര്യങ്ങളും ഇല്ല. ഇവർ പിന്നെ പറഞ്ഞ് എല്ലാവരെയും പേടിപ്പിച്ച് ഡോക്ടർമാർ പോലും പിള്ളേരെ കൈകൊണ്ട് തൊടിയല്ലോ. പിള്ളേരെയല്ല, ആരെയും. അതാണ് ശരിക്കും നമ്മളിവിടെ വന്ന്.
The purpose of showing this video is that we can treat children at any age. You can see this boy was about 10 years old, and the other one is 5 years old, just not 5, 4.5 years old, 4.5, 6 months old. Now, but both are having COVID. But we can't close. We can put them in a room and close them. But it was not done. The parents were lying with them in the same bed, and they didn't get the COVID because I have given phosphorus to them in those time, because they were. Why I give phosphorus? That is very important, because once the children are getting this disease, the bystanders said that they are the mother and father are much worried about it. They were anxious about these children. So the medicine given as preventive was phosphorus to them. In these cases, the elder boy was given Rustox, and the younger one was given Rosacla, because you can see the difference between them in their level. Also, this boy seemed to be the younger boy seemed to be shy, and the other one is not that shy. So another case I'm going to explain is a condition where the patient was at the hospital, and he was having a medical college. His oxygen level was so much low, and in those conditions, his bystander, that his son, he's working as a police officer, called me, and doctor, whether we can do something or not. He was crying. Like then, I just assured him that we can treat the patient if you allow to, if you give these medicines. And then the medicine was sent to him immediately after taking medicine. Immediately after half an hour, the oxygen level started improving, and within uh, 6 hours by about night, the patient become normal, and his oxygen level become normal, and they were able to discharge from the hospital in a very uh, short time. Now you can hear the video and see what he is telling.
അച്ഛനിപ്പോഴെങ്ങനെയുണ്ട്?
അച്ഛനിപ്പോൾ നല്ല മാറ്റമുണ്ട്. നല്ല മാറ്റം
അച്ഛന് ആദ്യം എങ്ങനെയായിരുന്നു? ഒരു ദിവസം പെട്ടെന്ന് തലകറങ്ങി വീഴുന്നു.
അച്ഛന് ഭയങ്കര ശാരീരികമായിട്ട് ഭയങ്കര അവശത കാണിക്കാൻ തുടങ്ങി. ഇങ്ങനെ ഭയങ്കര തലകറക്കം ക്ഷീണമായിട്ട് ഇങ്ങനെ ഞങ്ങൾ ഹോസ്പിറ്റലിൽ കൊണ്ടുവന്നപ്പോഴാണ് അറിയുന്നത്. ഇത് അവർ ടെസ്റ്റ് ചെയ്ത് ആൻറ്റിജൻ ടെസ്റ്റ് നടത്തിയപ്പോൾ പോസിറ്റീവ് ആണെന്ന് അറിയുന്നത്. അന്നേരം അച്ഛന് മറ്റുള്ള അസുഖങ്ങൾ ഉണ്ടാകുന്ന കാരണം ഞങ്ങൾ നേരെ മെഡിക്കൽ കോളേജിലേക്കാണ് പോയത്.
അച്ഛന് ഷുഗർ നന്നായിട്ട്
ഷുഗർ കൂടുതലുണ്ടായിരുന്നു. ചെറിയൊരു ഹൃദ്രോഗം നേരത്തെ ഉണ്ടായിട്ടുണ്ടായിരുന്നു. അപ്പോൾ അങ്ങനെ ഇപ്പോൾ അവിടെ വെച്ചാണ് ഞാനിങ്ങനെ ഞാൻ സാറിനെ വിളിക്കുന്നത്.
അവിടെ ചെന്നപ്പോൾ നമുക്ക് ഓക്സിജൻ ലെവൽ
ഒത്തിരി താഴ്ന്നു സാർ, ഒത്തിരി താഴ്ന്ന് ആകെപ്പാട് ബുദ്ധിമുട്ടായി. പിന്നെ അവർ ICUയിലേക്ക് മാറ്റുന്ന സ്റ്റേജിലായി. അപ്പോഴാണ് ഞാൻ സാറിനെ വിളിക്കുന്നത്. ഇതിൻ്റെ കാര്യങ്ങൾ എന്താണെന്ന് അറിയാനുണ്ട്, അവരെന്താണ് ചെയ്യാൻ സാധ്യതയുള്ളതെന്നൊക്കെ അറിയാൻ വേണ്ടിയിട്ട് വിളിച്ചതാണ്. അങ്ങനെയാണ് സാറിങ്ങനെ പെട്ടെന്ന് എനിക്ക് ഇവിടുന്നുള്ള ഹോമിയോ മരുന്ന് തന്നിടുകയും പക്ഷെ അത് കഴിച്ചപ്പോൾ പെട്ടെന്ന് പിന്നെ മാറ്റം, പിന്നെ അങ്ങോട്ട് പെട്ടെന്ന് മാറ്റം വരാൻ തുടങ്ങി. ICU കയറ്റേണ്ടി വന്നു. അതുകൊണ്ട് ഞാൻ എത്തുന്നില്ല. പിന്നെ ഞങ്ങളെ സാധാരണ ഓക്സിജൻ ഇതുള്ള വാർഡിലേക്കാണ് മാറ്റിയത്. പെട്ടെന്ന് പോരാനും പറ്റി. ഡിസ്ചാർജ് എന്ന് വെച്ചാൽ അവർ ഗവൺമെന്റ് പറയണ മിനിമം ദിവസം മാത്രമേ കിടക്കേണ്ടി വന്നുള്ളൂ. പെട്ടെന്ന് നെഗറ്റീവായി. അപ്പോൾ ഹോമിയോ മരുന്ന് കഴിക്കാൻ തുടങ്ങിയപ്പോൾ തന്നെ അതിന്റെ മാറ്റം ഉണ്ടാകാൻ തുടങ്ങിയെന്നുള്ളതാണ് ഏറ്റവും വലിയ. പെട്ടെന്ന് വയറ്റിൽ നിന്നൊക്കെ പോയി നല്ല സാറ് തന്നെ മരുന്ന് കഴിച്ചപ്പോഴാണ് പെട്ടെന്ന് വയറ്റിൽ നിന്ന് പോയി വിശപ്പ് പിന്നെ ഉണ്ടാകാൻ തുടങ്ങി. പിന്നെ ആ കാലിന്റെ ഒക്കെ ആ ഒരു തളർച്ചയും കാര്യങ്ങൾക്കാണ് പിന്നീട് പിന്നെ നമ്മൾ ഹോമിയോ മരുന്ന് കഴിക്കാൻ തുടങ്ങിയത്. അപ്പൊ അവർ പറഞ്ഞ സ്റ്റിറോയിഡിന്റെ കൂടുതൽ കൊണ്ടാണ്. അപ്പൊ അത് സാറപ്പോൾ അതിനുള്ള മരുന്ന് തന്നോട് കൂടിയാണ് പിന്നെ അതിലിപ്പോൾ നല്ല മാറ്റം വരാൻ തുടങ്ങിയിട്ടുണ്ട്.
നമ്മൾ അവിടെ നിൽക്കുന്ന സമയത്ത് നമുക്കും
എനിക്ക് സാറൊന്ന് പ്രതിരോധ മരുന്ന് തന്ന കാരണം എനിക്ക് വളരെ ചെറിയ രീതിയിലാണ് സാർ ഉണ്ടായത്.
നമ്മുടെ വീട്ടില് എത്ര പേർക്കുണ്ടായിരുന്നു?
വീട്ടിൽ ഞങ്ങൾ മൊത്തം അച്ഛനൊഴികെ ബാക്കി 7 പേരുണ്ടായിരുന്നു. 3 കുട്ടികൾ ഉൾപ്പെടെ എല്ലാവർക്കും ഉണ്ടായിരുന്നു. പക്ഷെ ഉണ്ടായതൊക്കെ വളരെ ചെറിയ രീതിയിലായിരുന്നു. ഹോമിയോ മരുന്ന് പ്രതിരോധം കഴിച്ചിട്ടിരുന്ന കാരണം
അവർക്കൊക്കെ പനി വന്നപ്പോഴും നമ്മൾ പനിയുടെ ലക്ഷണം വെച്ചാൽ
മരുന്ന്
മരുന്ന്
തന്ന കാരണം അതിന്റെ ആ വലിയ മാറ്റം. അതൊന്നും കൂടാതെ തന്നെ ഞങ്ങൾ ആ മിനിമം ദിവസം കഴിഞ്ഞപ്പോൾ തന്നെ എല്ലാവരും നെഗറ്റീവായി. അധികം ക്ഷീണങ്ങളും അല്ലെങ്കിൽ ആഫ്റ്റർ എഫക്റ്റ് ഒന്നും ഇതുവരെ ഉണ്ടായിട്ടൊന്നും.
അതായത് അന്ന് നമുക്ക് എന്താ പറ്റിയെന്ന് വെച്ചാൽ അച്ഛന് ഈ അസുഖം ആദ്യം 2-3 ദിവസം പനിയായിട്ട് നമ്മൾ അങ്ങോട്ടും ഇങ്ങോട്ടൊക്കെ പോകും. അച്ഛനിപ്പോഴെങ്ങനെയുണ്ട്?
അച്ഛനിപ്പോൾ നല്ല മാറ്റമുണ്ട്. നല്ല മാറ്റം.
അച്ഛന്
you can hear actually the all in the family, there was some 7 to 8% in the family, including 2 children, were affected by COVID, but all of them were given homeopathic medicine according to symptomatology and were able to cure within 5 to 7 days. And that's what he was telling in the later part of this video. So the purpose of showing this video is that we can also treat those conditions where the patient actually he was telling in this video that the 2 person who was lying on the side of his father were taken to the IC, and both were came out as dead. And immediately he was so much worried about this thing, and the doctors were advising him to take his father to this IC. So he was then at that time he called me, and then I requested him to wait for 1 more days, and after giving homeopathic medicine, he was able to discharge from the hospital within a day. That is a miracle of beauty of homeopathy. This is what the purpose of showing this video. And not only that, those person who were there, including himself, got COVID, but only very mild, where everything was cured with the homeopathic medicine, because none of them took any paracetamol or anything, any allopathic medicine from the very beginning. That's the reason why we are able to cure those patients who are coming for homeopathic treatment within a short time. This is another case of COVID, and he was also cured within short time. I'm not going to show that video. Then nowadays we are getting a lot of management post COVID cases also coming. That because most of the patient was none of our homeopathy cases go for any post COVID case. That is one of the most important thing we noted here. When you go for homeopathic treatment, there will not be any post-COVID symptoms. That is one of the things that only sometimes a patient may have a little bit of weakness that may go within 1 month without much medication. But frankly, the thing is different when most of the patients who are treated with allopathic medicine, then particularly those who are taking steroid antibiotic, are getting a lot of post-COVID symptoms. For example, I may show another here a case. You see, this is a case of a girl. She was having, she was doing her degree first year, and her father is running a medical store, and they're having a doctor with them. So when she got fever, they didn't go for any testing, but instead they just give some antibiotic for the 5 days. So she was getting worse and worse up, and then they give second dose of antibiotic also. That also really lasts for about 10 days, but within 10 days, by the time she was unable to move from the bed because of dyspnea. She was having a problem with the chest. One of her relative was under treatment for COVID. So they informed her that their parent that you may take consult this homeopathic doctor. So she was brought to my clinic, and on the 10th day, then I asked them to go for blood test. You can see D dimer is 1206. That's very high as far as her age is concerned. I was given, she was given our homeopathic medicine. As you know, the medicine given was tuberculum followed by this dyspnea, lying aggravation, night, and all those things were pulsatilla, followed by pulsatilla. You can see what a change, how the change after 1 week of homeopathic treatment. D dimer become 134. She was able to move. Uh, she was able to move about within 24 hours, and by about the 48 hours, she was able to do her things without the help of others. She was able to eat. She was able to pass stool and everything without. That is the BT. And after 1 week of test, you can see D dimer become 134. So these are the tests also. This is the relevance of testing these blood tests. And we actually, what happened, why this happened, this is more important. This patient was, as WHO itself has stated to the doctors, that don't give any antibiotic in a case of fever. But even our doctors in India, and particularly in Kerala, have no such feeling here. What they are doing is still they are giving antibiotic, even in a case that come for the first time. And that is how the problem happens inside the chest. So there is a internal bleeding happens, because when you give antibiotic in the beginning stage of COVID cases, definitely there is every chance of bleeding inside the lungs, and that's the reason why this this child got this girl got this much of D dimer in her blood. As you know, D dimer is a protein that is released from a clot that formed in your body. So the quantity of the increased quantity of D dimer means there is large quantity of internal bleeding. So that is the importance of a D dimer test. This patient was not my patient in the beginning of the COVID. He was having treatment with some other patients, some other doctors by allopathy profession, and he was after taking some 2 months of treatment. After COVID, he was having this edema of eyes, edema of the face, edema lips. I like that is recurring happenings, and he was finally came to my clinic without hope. He was utter despair in between. His marriage was over, but he could not even sit with his wife because of this problem. So he was even thinking about suicide like that. But frankly, he was saved totally by homeopathic medicine. You can see the differences here, how beautifully on the seventh day things happen, how beautifully things change. And after some 2 weeks of that, then his one abscess was formed in the lips, and this is lips condition. But naturally, you can see within 3 to 5 days, everything was clear. Now he is a firm believer of homeopathy. He has produced a video stating that he was having this black fungus and was cured by homeopathy like that. But actually, it was diagnosed at the Kottayam Medical College as a case of fungus disease and not a black fungus, because no further because the patient left the place and came to homeopathy. Now sometimes whether he continued there, he may be finally diagnosed as a case of black fungus also. But frankly, in those time it was not at all a notified thing, and only later nowadays it become a notified disease. But frankly, I must say that it is not a case. I will not say that it is a case of black fungus, but he claims himself that it's a case of black fungus. He produced a video, and that was released to the YouTube. You can see there in the YouTube. So how we select the remedy, that is more important. If how to study a remedy, then for example, arsenic amalgam, you have to study, read different books. For example, the very first sentence of the material medical text, you can see, you will get how beautifully this medicine works. For example, arsenic amalgam, you can see a profoundly acting remedy on every organ of the tissue. It clears cut characteristic symptom and correspondence to many other severe type of diseases, make it homeopathy constantly certain. Like that, the first sentence, then what about arsenic amalgam in this pathak? Very deep acting remedy. Mentally, the patient is like that. You just take a minimum 2 books and study. One is you may read arsenic amalgam in boric, then in Pathak, then Allen's keynote. Definitely will give you the, then you will be able to understand the beauty of that remedy. For example, the another remedy, that is phosphorus. You see, phosphorus irritate, inflames, and it regenerate the mucous membrane and inflames serous membranes,
Thank
inflames
you,
spinal
sir.
cord and nerves,
Sir,
like
sir,
that.
thank you. Sir, I think the time is up.
Okay,
And
okay.
it
Then
was
just only I'm concluding, and
okay.
this is how just how to study material medica. That's what the purpose of these are covered remedies. That's the reason why I'm showing. This is if you just study like this. If you start then bryonia in Alet, bryonia in boric, then like that lacus is in pathak, lacus is in boric, like that. Then you will not forget about the medicine. So this is what I'm going to wind up the so this is the time for discussion. And so if anyone want to ask some question, you can come out with your question, and we'll be able to clear. I think 15 minutes, 14 minutes more. Okay.
Anyone who would like to ask questions to sir, please raise your hands. Anyone?
If anyone have the questions, please hand raise in the chat box. Okay.
Sir, actually, I have a question. I mean, without injecting vaccination, can we withstand this COVID condition only with
Yes,
ourselves?
I would like to answer. I would like to say something about vaccination too here, because as you know, I got a lot of patients who are coming to the clinic with the COVID diseases after second dose of vaccination. I was able to treat several policemen and nurses from different part of our village, and even from different location. I got a patient. They use usually these allopathy people cheating us by way of vaccination. Frankly, there are patients who are suffering severe illness after vaccination, and there are cases coming as COVID after taking vaccination. I have a case, a patient who developed fever after taking vaccination from the second day onwards, and on the seventh day when he went for test for COVID, it was tested positive. And the thing is that even a vaccinated person can spread COVID. That is one of the thing I have noted. If you develop a little bit of fever in the after vaccination, the patient may be spreading this COVID. So, frankly speaking, our arsenic amalgam is one of the best medicine for prevention of this COVID than these so-called vaccines. We have seen that many of the doctors who undertook this vaccine even even were no more in the world even after second dose of vaccination. So what is the use of using this vaccination? That is something different. But being a policy of the government, we cannot even say no to that. But I have not taken any vaccine until now. I have examined so many patients, even in my clinic with COVID. Even I haven't I use any this thing in my hand. I never protect my hand with the gloves. I just simply touch, and I just like usually what we do in our early part of the series in the early days. It's the same thing, same kind of examination is going in even now. I didn't get any COVID disease till now, even though I have some other problems. So it does not mean that you require vaccine for this. If you believe in our system, you need not take the other thing. You just go with our homeopathic medicine. That will work. And if you have any doubt, then you can even think for trials also. After taking arsenic some 3 consecutive days, then you just wait for 1 week, and then you may take phosphorus for 3 consecutive days in the morning, and then you wait for one more week, and then you take a dose of tuberculin. This is how the trials being applied, and that also is a very good method also. Okay. I think I have answered
Thank
to
you,
your
sir.
question.
Anyone else has any question? Yes, sir. Definitely. If no one has any other questions, then we can move on to the vote of thanks by Fiza Nazreen. Please unmute, please unmute.
Hello, am I audible?
Yes.
Yeah. Good evening to one and all. It's my honor and privilege to propose vote of thanks. First and foremost, my sincere thanks to our chief guest, Dr. DHANESH JAYASIMHAN sir, who despite his busy schedule has found time to grace this occasion. Thank you so much, sir, for sharing your insights with us about the COVID management with homeopathy. Of course, the homeopathy has a wide range of scope. Then I'm grateful to each one of you present here for being a part of this empowering session. Last but not the least, I'm grateful to our masters of ceremony for their attempt towards the anchoring toward today's program. So thank you, each one of you. Thanks.